Hello, everybody, and welcome to the One Good Day podcast. My name is Jeff, and I am your host. Today, we are joined by Terri Bacow. Terri, how are you today?
I'm doing quite well, thank you.
Thank you so much for taking the time to join us. We really appreciate it. Before we get started, today's topic is going to be about CBT, which is cognitive behavioral therapy. Terri is an expert in this subject. And before we start, can you please give us your specialty as well as where anybody can find you on social media, book, website, etc.?
Absolutely. So I am a clinical psychologist in private practice in New York City, and I am the author of a book called Goodbye Anxiety, a guided journal for overcoming worry. This is a book that really includes CBT as well as other evidence-based therapy approaches for anxiety. It's really great for young people in particular, but I think anyone can read it. There's a journaling component, but there's also a lot of skills. And my areas of specialty really do include anxiety, mood disorders, ADHD, relationships, life transition. But I have to say anxiety is sort of my number one focus.
All right, fantastic. And then also, what about where they can find you on social media?
Thank you for the reminder. Folks can find me on Instagram, and the handle is at Dr. Terri Bacow. That would be DR. I also have a website, drterribacow.com.
And just for everybody, that's DrTerriBacow.
Right. I am also on Facebook.
Same name.
On Facebook, the name of the account is Terri Bacow Private Practice.
Okay, perfect. All right, so let's get into today. We start every podcast with the same question. What is your personal experience with panic and anxiety? Have you ever dealt with it personally? And if so, how did you handle that?
Yes. So I am really open about this. I have a hearing loss. So when I was younger, I'm almost positive I had a good dose of social anxiety because social interactions were anxiety provoking. If maybe I didn't understand someone or I had to ask them to repeat something. And I think as I got older, it became apparent that I am a closeted perfectionist, and I am pretty certain that I have again, a good dose of generalized anxiety, worry about how things are going to go.
Mm-hmm.
The way that I have dealt with that is really using many of the techniques that I'm going to talk about today and trying to apply them to myself. The advice that I give my patients, I also try to apply to myself. I also forgot to mention that I have a pretty obvious insect phobia. So the summer months are always interesting.
Okay.
There's bees flying about and all kinds of bugs. But I have learned that I need to keep that in check so that my children do not get the bug idea.
Yeah. Yeah. It's that's definitely I mean, it's a whole separate episode, parents and anxiety, but yeah, that's something that you definitely, it's hard because you can't have that anxiety because you don't want your kids to pick up the same type of behaviors and the same type of fears.
Right.
So let's get into the CBT part of this. And for those that don't know what CBT is, it is cognitive behavioral therapy. So can you explain in basic terms what CBT is?
Of course. So CBT is an action-oriented, solution-focused therapy approach. It really involves the therapist teaching concrete skills and strategies to manage symptoms. An example would be a breathing exercise or a thought experiment. These skills can be kind of delivered maybe sometimes in a didactic way. Now, CBT is still therapy. You're still talking to the therapist. You're still having an organic conversation, but it could be a little structured. And it's really also based on what we call a three-component model of emotion, which is the idea that thoughts, feelings, and behaviors are related. that they form a cycle. The way to break the cycle is that if you change your thought or you change your behavior, you could change the way you feel.
Yeah, absolutely. So can you talk us through what the process of CBT looks like? What might be a typical session, and how does it work to help alleviate anxiety and panic symptoms? And let's take a common fear. Me personally, I deal with a bit of claustrophobia and flying. So let's use me as the example. I've been actually working on trying to get on an airplane again for years, a few years now. So let's use me as the example as far as um, what a typical session may look like for CBT with me and my fear of flying, and how would you alleviate that with CBT?
So the CBT session is pretty typical. It's 45 to 50 minutes. A good way to start may be to set an agenda. What do we want to talk about today? What should our area of focus be today? Are we going to talk about the fear of flying or the claustrophobia? Set an agenda. And then after that, the clinician typically introduces a skill or a strategy, and we discuss that using a personal example from the patient's life. So I might say, tell me about the thoughts that come up for you when you're on a plane. What exactly are you afraid of? And then talk through a strategy you might use during the flight. Introduce the concept, explain it. And then at the end of the session, many CBT therapists may give a homework assignment. And the homework assignment could be the form of a piece of paper, a worksheet, or it may be an experiential exercise, like watch videos of planes taking off. That would be maybe an example of a homework assignment. But in terms of actually treating the phobia, typically the way the CBT works is we encourage the client to identify the exact concerns that they have about their situation. So with claustrophobia, what exactly, what are the situations where you feel claustrophobic? What are you concerned is going to happen in those situations? And how can we examine those assumptions and maybe challenge them? But I think the most potent part of CBT in terms of treating phobias in particular is action. And the way that CBT therapists think about it is you need to enter the field situation, and you need to enter it on purpose. And you need to do so repeatedly in order to overcome that fear. We call that exposure therapy.
And so, with that being said, let's talk about a couple of aspects of how people normally go into situations that they're afraid of, whether it's social anxiety or fear of flying or just generally fearing panic attacks. There's a lot of negative thoughts and negative anticipation around that. So does CBT help in regards to changing those negative thought patterns? If so, can you provide some examples of what we would work on?
Exactly. Part of the reason that we call it CBT is because of the cognitive component, which really does focus on those thought patterns. And I like to call them thinking traps. So I may encourage the client to identify what kind of thinking trap is your anxiety falling into in this situation. And we have a bunch of names for them. We have about 12, but a common one would be catastrophizing, thinking
Yeah,
that this is going to happen.
I'm pretty good at that. That is what happens to me in my situations when I get anxiety. I think I'm gonna have a heart attack. I feel like I can't breathe. I think I'm gonna die. That's usually the three that I go through with these types of situations. I am fantastic at catastrophizing.
Great. So am I. And I like to say it's really helpful to identify that you are, in fact, catastrophizing. You're thinking the worst is going to happen. You're thinking you're going to die. You're going to pass out. The world is going to end. And then once we identify and label, this is what's going on for you, we can encourage you to realize that your thoughts are just thoughts. They are not facts. Your anxiety is giving you all these ideas and causing you to jump to conclusions. And you need to examine those thoughts from a distance and kind of examine them critically. You have to lawyer up. You have to ask, do I have any evidence for this thought? You have to ask really specific questions. We sometimes call those Socratic questions. Or what it involves is taking the prediction that you're making and really exploring if you have proof. Now, you think you're going to die, but have you ever died before on a plane? Have you ever passed out before? What's the likelihood that this is going to happen? This sort of emotional reasoning, which is when we have a thought, we're really convinced that it's valid. But then we want clients to engage in more logical reasoning, which is, what are the facts? Let's check the facts. What are the statistics for flying? How many planes actually crash? And so forth.
Okay. And is that something that you're doing during the anxious moments, or is that something you're doing in advance when you're worried about what's going to happen? Because, for me, like if I have, if I have to go into a situation that makes me anxious, I have those physical symptoms ahead of time. I'm already, you know, half in a panic mode before we even get there. So are you having these internal conversations and rationalizations before or during or both?
It's so helpful because it gives you a tool and you feel more prepared. And these same concepts can be applied in the situation itself. So in addition to ahead of time, when you're actually in the situation, I encourage clients to use what I call coping statements. And these are like affirmations or mantras. And an example would be, this is rough, but I can handle it. I can get through this. The last time I did this, it turned out fine. And rehearsing these statements can be a way to really put CBT into action in the situation itself.
And okay. And so CBT obviously is a very popular form of therapy, but there's also a lot of other types of therapy out there. How may somebody know that CBT is the right choice for them? And then what makes it different from, talk therapy or EMDR or some of these other things? Are you using it in conjunction with some of this other stuff, or are you doing only CBT?
Well, in terms of it being the right treatment, I mean, maybe I am biased, but I also think the research supports this, that CBT is the gold standard for anxiety and mood disorders. If you have an anxiety disorder, CBT is the way to go. And there's some similar approaches, for example, acceptance and commitment therapy, ACT. So there are kind of third wave treatments that are similar to CBT. But I would say that CBT is the OG, it is the
Okay.
the and it's certainly what I practice, so I do recommend it. I think
Yeah.
the way that you could tell if CBT is right for you is if you're looking for a structured treatment, you're looking for symptom reduction, you're really looking to feel better quickly, and you want to collaborate with your therapist.
Okay, so let's talk about that as far as the timeline is concerned. Obviously therapists never never want to make a commitment that they A can fix you and B, how long it's going to take, but you had mentioned that, something that you could potentially feel better quickly. On average, and obviously this to disclaimer this is no guarantees of CBT and everybody's different, etc. But on average, if somebody comes in and they're dealing with regular panic attacks and a lot of anxiety, how long does it usually take you to help them alleviate some of those symptoms and be able to back some of that down, so that they're not dealing with so much of that?
So the time frame ranges from person to person. But when I was in graduate school, I worked in a research lab. I did a research study where we were delivering CBT at 8 weeks, 12 weeks, 16 weeks. So it can be a short-term intervention. It could also be longer term. But in terms of immediate symptom reduction, a lot of the components are rather potent. So when it comes to, for example, panic attacks, one of the most powerful pieces of CBT is just giving client information. So when it comes to panic, a lot of people really are afraid when they have a panic attack, like you mentioned earlier, that they might die or pass out or have a heart attack or faint. And so
Yeah.
what we do in this CBT session is we give information because it's psychoeducation. And an example would be the panic is simply a feeling. It's part of an oversensitive fight or flight system that the anxiety is acting up, but it doesn't mean the danger is present. And that the key to coping is to change your interpretation of the sensations you're having in your body and to no longer view them as dangerous or a sign that anything is wrong or catastrophic. So that little bit of information alone, for example, can really change a person's entire mindset. So it's not uncommon in a handful of sessions for people to feel better. I have seen that happen.
Okay. And I'm going to throw in a disclaimer here in regards to anybody that's new to dealing with anxiety. Before you start your anxiety treatment, it's always advised to get a full physical exam. Make sure that your heart, your lungs, your blood levels are all in normal working order, because there are certain conditions that can cause anxiety, and you want to make sure that none of those are present with you, so that when you do fall back on these thoughts, you know that your body is in good working order and that your anxiety is what is causing you to have fast heart rate, trouble breathing, feeling like you're going to faint, etc. It's a lot. For me, I've always found it to be a lot more concrete to fall back on, knowing that my physical health is in good standing, to know that this sensation is being caused only by anxiety and not by anything else.
Exactly. And that is a reframe. You change the way you think about these feelings. And by changing the way you think and changing your behavior, you could change the way you feel. The behavior piece is really important in CBT because a lot of anxiety, what anxiety does is it causes avoidance. When we feel anxious, we're tempted to avoid the situation, to cancel the plan, to cancel the flight, to engage in safety behaviors. And I always say anxiety and avoidance are best friends, they're in collision with each other. And we need to break up the relationship. And the way to do that is the opposite of avoidance is approach. And again, this is how exposure therapy works, by gradually entering the situation. So if, for example, you were maybe avoiding situations where you felt panicky, I would have encouraged you to enter the situation on purpose, to realize that it's going to be okay. And one other quick point,
So,
the goal is never to eliminate anxiety completely, but to learn how to manage and cope with it.
let's talk about going into those situations that make you panicky. So that people don't just go rush out and do what makes them panic. I would assume that you would probably advise that people have some form of coping tools before they go into those situations, correct?
Yeah, so coping tools can range from doing a breathing exercise, really slowing down the breathing, engaging in relaxation, diaphragmatic breathing. That could be done anytime, anywhere. Coping statements are really helpful. Um, Problem solving is another CBT strategy, and it sounds so simple, so innocent, problem solving, but it can make all the difference, which is having a plan for how you're going to cope, who you're going to talk to, whom you're going to ask for help, um, changing your schedule around to make something work better for you. This is where the nuts and bolts of CBT are useful, and they could be done on a daily basis. You could be on vacation and do a breathing exercise, or reframe your anxious thoughts, or kind of figure out how you're going to solve something that's really worrying you.
Yeah, absolutely. And just to circle back to this point, as far as if you're having panic and anxiety issues, make sure that you are seeing somebody to help you build up these exercises and learn how to and practice these so that you can feel more comfortable going into situations. Usually you don't just want to run into these panic situations without these tools, because you definitely can make it worse. You can build up those fears so that they're even harder for you to deal with. So once you get comfortable that you have a good plan and you have some good exercises to fall back on, that's definitely when you can start pushing that line to be in situations that make you uncomfortable.
For sure.
So let's talk about obviously you're in therapy, you're practicing CBD, CBT, and let's talk about how I can practice this outside of a therapist's office. How can individuals apply these strategies in their everyday life?
Right. So as I mentioned before, you could be waiting in line at a grocery store and you could slow down your breathing. You could down regulate your nervous system by taking some slow breaths in, pausing, and exhaling. You could use self-talk, which is give yourself a quiet pep talk using the reframe that you came up with in your therapy session. You can utilize coping statements. So, for example, if you're at work, you're about to give a presentation, you could say to yourself quietly, this speech does not have to be perfect. You could use problem solving on a daily basis. The next time you're worried about something, try to figure out, instead of, oh my God, this is so overwhelming, which again is understandable, to figure out, well, what could I do? Who do I talk to? Let's say you're worried about a test that you have to take. Really examining the likelihood that it's going to go poorly, given the facts, which you studied quite a bit. But, if it doesn't work out, if you do get a bad grade, what will you do? I encourage clients to replace statements of what if with even if. So
Mm,
instead of what if I failed this test, a good reframe would be even if I failed this test, I could speak to the professor. I could ask to take it again. I could study hard on the next one and bring my grade up. So I do think outside of the session, these strategies can be used and integrated into a person's routine.
okay, and I will challenge that, even if, and ask how you'd handle if you catastrophize in for my situation is I always catastrophize health. So I would say, even if I stop breathing, or even if I have a heart, how does that how do you handle it with those types of statements? I can't say, even if I have a heart attack, somebody will say, that seems to me that it may not be as productive as it should be.
Great point. I think my response to that is there's certain instances where the even if statement works really well. And there's other instances where it makes more sense to focus on the probability and to look at probability overestimation. Because
Yeah.
those instances, dying and having a heart attack, are incredibly unlikely. And what
Yeah.
anxiety does is it causes us to way overestimate the likelihood that this catastrophic thing is going to happen. Now, if you did die, that would be awful. However, it's so improbable. I encourage clients to think about the difference between probability and possibility. Just because something is possible doesn't make it probable. So I would take a different cognitive approach with that fear, if that makes sense.
Yeah. Okay, yeah, absolutely. And to build off that foundation, if you've had that physical exam recently, you can then say, "Hey, I just had my heart checked or my lungs checked, a month ago or 2 months ago, and everything was fine. So it's not likely that this is serious." So you can build off of that behavior that you've already been looked at and use that as some stabilizing foundation. So let's talk about CBT as a therapy. Is there a specific type of individual or condition that CBT may be better for, and are there those that may not benefit from CBT?
Yes. So the condition that I would say it has the most empirical support by far are anxiety and mood disorders. But in addition, CBT has been known to be effective with eating disorders, ADHD, and even psychosis in some instances. So it does have a wide applicability, but certainly there are some conditions where a different approach would be better. So for example, if you have personality disorder, such as borderline personality disorder, which is a condition where someone engages in a lot of impulsive behavior and it affects their relationships, and those instances, a slightly different approach. I mean, sometimes this is alphabet soup.
Yeah.
Dialectical behavior therapy, DBT, would be better for that person.
So let's talk about then, who would I want to talk to see if CBT was right for me, and then if the decision was made that CBT is right for me, what am I looking for in a therapist to get the best possible treatment?
You're looking for someone who actually provides CBT, someone who is adherent to the method. I mean, I think some therapists might say, I do CBT, but they don't. So I know it might be hard to tell, but you want to look at their credentials, you want to look at their profile and their website, and is CBT mentioned? How much of a focus is it on the website? Did the person
So
have a reputable degree from a reputable institution? And do they understand
provide
what they're saying? When you speak to them, does the therapist seem knowledgeable and competent?
provide a few questions for those that are listening that they'd want to ask a prospective therapist to get a gauge of whether or not CBT is a big part of their practice and whether or not they're qualified to do CBT with the patient.
Well, what you just said a moment ago. How qualified are you? You can be really direct. You're the customer.
I don't know about. I mean, no therapist is like, I'm really not qualified to be a therapist. Like, you're not going to get that answer. So, is it like, are you asking how many years have you been doing it? Is it a certain part of your practice?
I think there are more gentle ways to ask about that. So certainly how many years of experience you have, how long have you been in practice for? You could ask about their training, if they have any certifications, or
And are there any specific CBT certifications you should be looking for if you want that in a therapist?
so not all CBT therapists have those certifications. Some of them do, but some of them just have really great training. And maybe they don't have um, ABPP diploma status, or maybe they haven't taken a course where they got a certificate, but they're still really well trained. But you could ask the clinician, once again, how confident are you that you could offer the treatment to me? How much experience do you have delivering it? And how much is it a part of your practice?
Okay. So yeah, those are all fantastic questions, and obviously we know that you're dealing with anxiety issues already, and sometimes confrontation is tough. But at the same time, if you don't get treatment from a good therapist, it's not going to get any easier. So you have to prepare ahead of time, write your questions down, maybe even email your questions if you don't want to talk to them on the phone. But definitely, if you're looking for a qualified therapist, make sure that you ask these questions, because there are some therapists out there, especially younger ones, that are trying to build their practice, and they will say that they do everything under the sun and they're not qualified to do it. So be very wary of that and make sure that you get your questions answered before picking a therapist. Um, so also, I want to be able to provide some resources for people that might be considering CBT. So other than your book, do you have any books or websites or people that you follow on social media that you love for CBT related information?
Yeah. in terms of resources, one first thing I'd like to recommend is an FAT, Find a Therapist Search Engine.
Okay.
An example would be abct.org. I'll repeat that, abct.org. That stands for the Association for the Advancement of Behavioral and Cognitive Therapies. They have a great search engine. Another good one is ADAA.org, the Anxiety and Depression Association of America. If you go to that website, there's a search engine where you can find a therapist. Another great one would be APA, the APA locator, the American Psychological Association, on their website also has a search engine. So these are all great ways to find a CBT therapist. You could try calling your insurance company. You could try asking for a physician or pediatrician for a referral, or a school guidance counselor. Asking professionals for recommendation can be a good way to find a CBT therapist. I also think, therapy can be expensive. And if it's something that you're not able to afford at a particular moment, I think the self-help books and websites can be fantastic. And certainly I am a fan of my own book. I'm going to hold it
Yeah.
up.
Yeah.
And please stand
Move it
back.
more into the move it more into the camera. We can't see. So
Yes.
it's called Goodbye Anxiety.
Yeah. And like I said earlier, it's really comprehensive in terms of evidence-based treatment, but I deliver them in a relatable way. The book is fun to look at. It has good colors. It's short. It's not too long. There's exercises. It's manageable. And I also have a lot of humor in it and a lot of pop culture references. So I feel that my book is a good way to learn about CBT without it being too academic, but also based in science. And then other resources that I can recommend. I do like the Anxiety Canada website. That's a good one. And I believe that you have a fantastic website that
Oh, thank you.
you do.
Yeah, thank you. Yeah, our website is panicandanxiety.org. So thank you. I appreciate it.
Of course. In terms of social media, there are many accounts that are really wonderful, almost too many to count. I'm trying to think if there's anyone in particular. I mean, I think if you go to Instagram and you enter terms like anxiety, OCD, you're going to see some really wonderful accounts pop up. And
Yes and no, I guess I will say, because I think you have a lot of social media therapists out there that say what sounds really good on social media, but you don't actually get a practical application for it. So just be careful. When you're looking for somebody for advice on social media, check their credentials as well. Don't follow somebody that's a quote unquote coach, or don't take their what they say as the gospel. Make sure that they're qualified to be talking about what they're talking about.
that is such a good point, and I completely agree. I think that once again, I just discovered a wonderful community on Instagram, and I have befriended some really reputable colleagues. But I think that I also know what to look for, and it can be hard if
Yeah.
you don't know what to look for. So nobody should ever give advice on social media. It's not a replacement for therapy. Self-help books are also not a replacement for therapy. But we all need to start somewhere. And sometimes a
Yep.
bite-sized amount of information can really make a difference. It can change your entire outlook.
Yeah, 100%. And being part of a community online that are going through similar things that you're going through also really helps to understand that you're not alone, and that you have people that are going through something similar and can potentially help you as well. So just be careful as far as the communities you join, and make sure that they do have your best interest at heart, and that the people that are running them are qualified to do so. So I want to close with what is your best piece of advice for somebody dealing with panic and anxiety issues?
What piece of advice?
I never throw this on the question sheet. I always want to
Fine, it's fine.
I always want to catch you a little bit to get a true answer.
Okay. The number one thing, you do not have to suffer. Anxiety is treatable. You don't need to white knuckle it. You can seek support, you can get help, you can feel better. It's not worth it to just sit with it and to suffer. I think it's really important that people with anxiety or panic take action, that they seek therapy, that they seek support, that they find ways to feel better. And I do highly recommend CBT as an approach. The research I support it. And really, one of the most powerful things about CBT, one of the most potent things that it offers, is the idea of avoidance. So if you can, it may be tempted to just stay home. It may be tempting to cancel the plan, and it's understandable because anxiety is really painful. But I always encourage my patients to take the opposite action, to show up, see what happens. Anxiety tries to trick us, and we need to stand up to it as if it's a bully. And we need to do that by not letting anxiety rule our lives and influence our decisions. And the way to do that is really to avoid it.
All right. Fantastic. And thank you so much, Terri Bacow. Sorry. Once again, social media is Dr. Terri Bacow. That's DrTerriBacow. The book is Goodbye Anxiety, and your website is also drterribacow.com, correct?
That's right.
Fantastic. Thank you. Thank you so much for your time. We really, really appreciate it.
Thank you for having me.